Hello everyone, warm greetings from Indian Hospital and Heart Institute, Mangalore. I am Dr. Vijaymahantesh, consultant pediatric and neonatal surgeon and pediatric urologist working at Indian Hospital and Heart Institute, Mangalore. Today we will be discussing something about urinary tract infections in children. So unlike in adults, especially so in sexually active women, where urinary tract infections are quite a frequent occurrences, urinary infections in children are not that common and they are also not that innocent. So what do we define urinary tract infection as? So urinary tract infections are the conditions where microorganisms are growing into the urine. Urine per se is a sterile substance, so usually there won't be any microorganisms growing into the urine. But in certain situations, when there are associated abnormalities, there can be urinary infections which can be associated with high-grade fever. What sets the urinary infections in children apart from those in adult is that many a times in the children, they are associated with other associated abnormalities. So there can be any renal abnormalities or there can be abnormalities in the urinary tract. The most frequent association will be the presence of vesicourethral reflux. This is a condition where urine travels back from the bladder to the kidneys. So usually urine is produced by the kidneys, flows through the tubes into the bladder. But in this condition called vesicourethral reflux, the urine travels from the bladder into the kidneys, predisposing the kidneys to urinary tract infection. Other than that, there could be other conditions where there is stasis or stagnation of the urine because of some obstruction in the urinary tract. Also nowadays we are seeing so many children with constipation because of westernized diet. So a loaded rectum or presence of fecal matter into the rectum pushes on the bladder, causes retention of urine in the bladder and predisposing to urinary tract infection. So needless to say, whenever we are treating a case of urinary tract infection, apart from treating the infection itself, we have to put all our effort to identify the causes and the predisposing factors. A repeated urinary tract infection or recurrent urinary tract infection predisposes the children's kidneys to severe damage. So we have to identify the predisposing factors and treat them accordingly. So this is it for today, and the next time we'll be meeting with some other interesting topic. Thank you.
Indiana Hospital and Heart Institute. Aid. Inspire. Aspire.